Hi, everybody. My name is Kim, and I'm the coordinator with the Parent Cafe with ACE Academy. And I would like to introduce to you to our upcoming workshop, Family Mental Health. We have two experts in the field that are joining us and sharing about this topic. We have Dr. Conrad Webster from Black Boy Hill, and then we also have Ashley McGirt from Washington State Therapy Fund. These experts are bringing us information from resources to tips to strategies, all surrounding the idea of positive, healthy mental health for Black folk. So stay tuned, keep listening. You will find that this workshop is extremely helpful. All right, talk to you soon. Bye.
How mental health is viewed in the Black community, I think it's important to really explain what mental health is and differentiate it from mental illness, because oftentimes those two words are used interchangeably, and we all have mental health. And I believe the latest statistic was like 1 in 5 of us has a mental illness. So I think when it comes to the Black community, it's often viewed that mental health is actually mental illness when it's not. And there's a negative connotation around mental illness because there's this false notion that mental illness is something that we don't have in the Black community. It's something that's what white people have. And it's due to the legacy of systemic oppression and the history of psychology and how we were treated when it actually comes to managing our mental illnesses, to why there is such negative implications for people in the Black community. And I can go on and on, but I'm going to go ahead and have Dr. Conrad interject.
Yeah, just to piggyback off that, I think it also depends on the demographics and the sub-demographics of what we're talking about as the Black diaspora and how we look at it. Some folks, as Miss Ashley said, is a lot of Black people say therapy is not for us. And this runs counterintuitive to the survivalist mentality that we had, that we have been through so much adversity. Why would we need therapy, or why do we need to talk about mental health now? And for some folks, it's viewed as a weakness. And seeking treatment in itself or seeking advice from professional helps can also be a barrier, similar to what Miss Ashley said, by our historical context of the misuse of medicine and how they was tested upon African American folks in this country. So you have a stigma, and then you have some that are in fear of like what mental health is, what mental illness is, and how to approach this type of conversation in our community.
Absolutely. And when we look at the research, we see that 25% of Black people actually seek mental health treatment, as opposed to 40% of our white counterparts who are actually seeking out mental health treatment when it comes to things like therapy. Health for poor Black people, not just poor Black people, but all Black people, no matter what your socioeconomic status is. You could be extremely wealthy, you could be extremely poor. And I would say that the number one reason is related to discrimination, stigma, racism. When we look at the impact that racial trauma has on our mental health and our psyche, it's literally killing us, which is why we see that African Americans are dying at disproportionate rates from chronic stress-related illnesses, preventable things, when it comes to our mental health, our physical health, and how it's all related. So it really doesn't matter if you are high income or low income, because racism impacts everyone, no matter what their socioeconomic status is. I would also say long-term severe stress, intergenerational trauma, and then of course, when we are talking about poor Black community members throughout the entire diaspora, poverty in and of itself impacts mental health. And for me as a clinician, that's one of the most difficult things to help people work through, because I can talk to you all day through your problems, but then you still are unhoused or you still can't turn your lights on. So how do we work through the trauma of poverty?
Right. And I would piggyback and say this is not a new phenomenon. Has been happening since the creation of how Black bodies are viewed in this country, from the structural racism to the implicit biases on how medical providers are interacting with African American folks, and to where we are seeing people being misled to emergency rooms instead of where they need to have preventative care at and the appropriate preventative services. So we have a loss of seeing African American folks in our therapist facilities or getting guided counsels because they just don't know. So in a sense, in larger society, that may seem like there's poor mental health for African Americans, but it's actually just an implicit biases on who do we go to and how do we get this information. Can I get it first, Ashley?
Yes, I was gonna let you. Let me not keep answering first.
I got you. I would say we kind of mentioned this earlier, but it's the historical misdiagnosis and what's been happening in our Black community and the higher rates of the impacts that has been given in our community. You can look at the Tuskegee experiment. You can look at the forced sterilization, Black women. You can look at child vaccinations. You can look at COVID. We're often the test, I don't want to say dummies, but we're often the test people in order for these drugs to be passed. We're often to test people to see the impact that it has on these bodies, and it has a long story, a long impact of oppression, and the mental health framework in itself and how it's built and embodied to do these type of works have been affecting us. And not only that, schizophrenia has been a big thing in our Black community, to where it's often looked at as a Black disease because it's been disproportionately diagnosed since 1960s in Black males, and how it's having this impact and this trajectory of how our kids are funneled in different educational placing, and not even in just education, but outside in the large society, the hospitalization and being misdiagnosed and what that leads to also.
And I definitely agree with everything that you said, especially when it comes to schizophrenia. One of my favorite books is The Protest Psychosis, and it's about how schizophrenia became a Black disease. And when you really look at bias and racism and how Black people were treated, a Black man can walk into a psychiatric facility with the same signs and symptoms of a white male, but the white male will be diagnosed with bipolar, yet the Black man's going to be diagnosed with schizophrenia. And we know how schizophrenia is perpetuated throughout community and the negative connotation that it has with it, and just the overwhelming amount of harm that overdiagnosing and misdiagnosis has done on our communities. And when it really comes to challenges faced by Black community members in receiving mental health access, it's finding adequate quick care providers. There's less than 2% Black psychologists throughout the entire United States. And then when you look at social workers, LMFTs, and other forms of clinicians, those numbers are drastically lower than our white counterparts, which make it extremely difficult. Then you tackle on costs. Health insurance, the way that insurance is looked at from a crisis-centered model and not necessarily a preventative model, where you may not necessarily have a DSM-5 diagnosis, but in order for insurance to continue to bill, the provider actually has to put a diagnosis down. And we could say you're adjustment disorder and all of those different things, but that's another issue when it comes to challenges. And hearing these stories, when we look at the Tuskegee experiment, all of the things that Dr. Conrad said, it creates a fear within our communities and within our families when it comes to accessing. And not only that, but just language, how we respond to people receiving therapy and seeking therapy is definitely getting better. I really love the social media wave and how millennials and Gen Zs, whatever, are really working hard to push therapy. But it's like, yeah, go to therapy, but then access. How do I find a provider when all the providers who look like me are booked and busy, or I can't afford the provider, or that provider doesn't take my health insurance and I can't pay out of pocket, which is why we created the Therapy Fund Foundation to help with some of those challenges. But I think those are some of the main things, definitely going back to it really all goes back to American chattel slavery and racism and how we were treated, the whole medical apartheid that was done on Black and brown bodies.
Yeah, the big loaded question right there. I would say for the African American youth that I've encountered, and just to let y'all know, for the folks who will be looking at this video, I run a company called Black Boy Heal, where I provide mental health services for African American identified boys. So that looks different for non-binary, trans, and our cisgen African American boys. But what I've encountered has a lot to do with depression from our educational schooling system and the hyper surveillance that these African American males experience out in the larger society. What is fear and anxiety to them? A lot of African American boys are having issues with, like, how do they cope and display what they're having fears with, and what does that look like in their bodies? Whether it's cognitively or somatic. Then often we have seen a problem with drug and alcohol related issues, because some of our kids don't know how to manage or talk through or even know where to go to talk about issues with mental health. These are the problems that occurs, and it's rapidly growing, as you can see now, with fentanyl being something that's killing our African American children at a high rate. This is something that we're trying to bubble down in our mental health services.
I will say that African American youth really suffer from depression, anxiety, especially when we look at Black boys. So I really love the work that you're doing, Dr. Conrad, because we know that suicide is the third leading cause of death for Black boys ages 13 to 24. So it's extremely important that we have organizations like yours that are doing the work that we're doing. I think also when it comes to Black youth, especially now, it was a lot around COVID and adjusting back to being in school, virtual life, activities being closed, different things like that, that has really impacted how our youth show up. It'll be really interesting to see the research and the studies around the mental health implications of our youth from this time. I was just recently watching a documentary called Katrina Babies, and talking about the long lasting mental health implications from those who were exposed to Hurricane Katrina and who grew up in that. So I imagine the same would happen for what we call COVID babies, those who actually experienced that during our youth. But yeah, definitely depression, anxiety, those are things that we see a lot when it comes to Black youth.
And can I add on to that too? So being new to Seattle, I have seen a lot of African American youth, especially this time and through the summer, where a lot of our youth are dying to gun violence and just this big oppression that is holding them to be depressed. And it's like we're trying and we're searching for answers and trying to get our youth to talk. That's another issue that we're having with mental illness, that our youth don't want to talk. They have so much PTSD that's been happening from these traumatic incidents that they have been numb, or they have been silenced when they often have to talk to police officers or other medical facilitators that are telling them misinformation, or they're treating their information as it's not important. So I think a big issue that we're often having in our community also is getting our youth to talk, and providing the correct providers for them that look like them, that understands what they're going through.
Absolutely. I absolutely agree with all of that.
I think I can answer that in four different ways. One being that this is the first people, first groups that you express yourself to. All right. And sometimes this is like your safeness. This is your safety. This is your home. You feel comfortable with it. And then also there's an interconnection of what you believe to be your foundation, your values. So when you can talk to somebody about your values and they understand it, then it's important to have that conversation around whom you are and whom you're coming to be, which is important for mental health. It can also, that was going to be the next question. How does family affect mental health? I'll let you go. Yeah.
So yeah, family is extremely important when it comes to mental health. It's a bond that can really connect and strengthen you at times when you're in need. When you have that connection, it also actually impacts a lot of ways in which we behave. If we look at epigenetics, which is the study of how your behavior actually are impacted based on your environment, which is through your familial relationships. And we know that women carry all of the eggs that they'll ever have throughout their lifetime. So I was actually carried inside of my grandmother, who's inside of my great grandmother, and so on and so forth. So if we look at their lifespan and the things that they were going on during that time frame, it actually impacts us today. So family is extremely important, especially as how we're raised. When we look at things like attachment and how we form connections and bond with other individuals, that's all based on how we were raised and how we were brought up through our family, whether it's a chosen family or your actual biological family, which is where the whole epigenetics thing that I came in. But it's definitely can be very positive or very negative, but it has a profound impact.
I think
Good or bad?
also, oh, okay. Can y'all hear me?
I think I kind of said that too, not looking at it.
I think religion plays a huge role in how we talk about mental health and what the care is for mental health, and how family plays a role in that. You have traditionally some families who believe you just pray through it, right? And we don't have any mental health issues, which causes us to be silenced in that moment. You also have folks who, the intergenerational trauma that is carried to where we normalize behavior that impacts us to be something that we just do, right? And especially in our African American communities, we have seen intergenerational trauma that hasn't been met or been healed from, that carries on into our children. So you have that, and then you have religion for me. But I know Miss Ashley has something.
No, definitely all of those things that you said and what I said earlier, just in terms of how mental health and family can all be impacted, especially when you come from a family that has a history of mental illness, that can be passed down, or just seeing how your family members respond to certain mental health challenges and struggles can impact you in your day-to-day life. And we know that, like, children who come from divorced households, or even looking at adverse childhood experiences, your ACE score, and things that occurred within your family and how that actually impacts your mental health. Did you grow up in a household where someone was incarcerated, where someone, was divorced, where someone was abusive? What did that environment look like? Was it a loving environment? How were you shown love? All of those things can impact your mental health.
Yeah. And you can also add into that when we don't get our kids diagnosed, like, untreated mental illnesses or challenges, mental health challenges that may support our children. Like, some of our families just don't believe in it. So these are some of the things that can negatively impact our mental health.
And communication, it's extremely important to talk. And we know that in a lot of Black families, there's this unspoken notion that we keep things quiet. It's within the family. We don't talk to people. We don't tell others what's going on. And that's actually been extremely harmful when it comes to looking at our mental health and how we heal. And what Dr. Conrad just said, not getting individuals diagnosed, getting them the treatment that they need, because we're going to be hush hush about it. But we all know that Uncle Joe or whoever the case has this problem. We all see it and we just turn a blind eye to it. And so we have to really break those generational curses and really do our part to seek the help that we need as family members experiencing individuals in crisis, or if we're the person in crisis ourselves.
I start with checking my unconscious bias. Oftentimes we have gone through experiences in our upbringing that we feel like we have all the answers to, and we try to give folks those same gems, but sometimes that's not what they need. So it's about being a listening ear, checking your unconscious bias, providing the safety and safeness to have these type of conversations with your youth, or even if it's with other adults, to like understand what mental health is, and how does mental health look in your family, and what is the historical context of mental health in your family, because oftentimes we don't know. How did grandma live, how did great grandma live, and sometimes we don't have those answers because either we don't have that connection, or again, it was something that has been intergenerational trauma that we don't want to talk about. So now that we have to have these critical conversations, like how do we bring that to each other and not silence anyone from their experiences that we didn't know of and we're trying to support with.
I definitely support and agree with those things. I do that as well in my own family. And I think for me, it's extremely important for me to recognize that while I am a licensed clinician, when it comes to my family, I'm Ashley, I'm cousin, sister, bonus mom. I don't come to my family as a therapist. I show up my authentic self and we have conversations, but I don't try to treat them. I will give them the education and the knowledge. I bring them into spaces like the ones that I'm a part of. For example, the conference that we're having this Friday, my nieces and nephews are going to be there, my sister, my brother. So my mom's going to be there. My mom's a registered nurse. So we have conversations openly about mental health, about mental illness, about how it's impacted our family. I come from a family that has a legacy of addiction. We have a lot of alcoholics, a lot of drug addicts in my family. And there was a time back in the 90s when nobody was talking about it, but now we're talking openly about it. And we're like, how do we break free from this? How do we heal this curse of addiction that's been rampant within our families, and help those within our family who are still struggling with that, and getting them the right support, and knowing that it's not me, obviously legally, ethically, I can't be their therapist, but making sure that they get the right support, talking to them about coping skills, giving them resources. So that's how I show up to keep my family well. In my own individual household with my husband and our kids, we really prioritize rest. I love the NAP ministry. If y'all aren't familiar with, it's them. They're based out of Atlanta, and they've really created this revolutionary practice that rest is resistance. And you know what? I'm going to take my naps, and I'm not going to be booked and busy. I'm going to be booked and well rested. I'm not going to work myself to the grave. I'm a researcher, and I talked a lot about the implications of American chattel slavery. And through looking at the research around American chattel slavery, I'll never forget these images that I came across of enslaved individuals. Their bodies had been exhumed. It was in the New York Times. And when you look at their bodies, the muscle had literally detached itself from the bone. And I often wonder if that's where the saying, work yourself to the bone, came from. So within my family, like I said, my own household, because when I talk to my mom's a workaholic. So we're working on her with that. But in our household, we prioritize rest. And, we want to make sure that we have the energy, that we do the things that are fulfilling and fun to us, and that we take time off, and that we nourish ourselves, and that we travel. Travel is really big for us. And I also know that it is a privilege to be able to travel, because of cost and all of those things, and access to transportation, whether it be a car or a plane or whatever the case may be. But that's something that we do within our family, and how we heal. It's how we um, visit other family from across the United States, across the globe. We're getting ready to go to Africa with several family members in a couple weeks. So that's just something that we like to do within our own particular family system. And again, having these conversations and talking openly, and not hushing things. And it's been very difficult, especially because there's been a lot of things that nobody wants to really talk about. And there's still a struggle there. My family's not perfect. No family is perfect. But I think it's important to, in order for families to be mentally healthy, that we put the resources out there that are available. You know, I'm the founder of the Therapy Fund Foundation that provides free therapy. So of course, my family members have access to that as well. They are Black people as well, which is who is our intended market, our intended audience, so that Black community members can heal. And I think just having other people in the medical professional in my family also makes these conversations a little easier. Like I said, my mom's a registered nurse. We have doctors, other medical professionals within our family. My sister's a social worker, all of these different things. And we just come together and we heal, we cry, sometimes we argue, we fight, and we fuss, but we move through it, and we look at, okay, this is the problem. How do we get through it? What is the solution? Well, of course, the Therapy Fund Foundation, as the founder and CEO, I'm definitely going to advocate and promote the Therapy Fund Foundation, not only because I'm the founder, but also because it works. And therapy is just one tool. It's one way, it's one resource. And that's something that we would love to share with your families, so that they have access. And therapy isn't the only thing that we do at the Therapy Fund Foundation. We have peer supports, so that you can speak with someone who may have lived through something that you've gone through, and that they have the skills to help you navigate through whatever that is. We have Preserving Black Families, youth healing. Dr. Conrad mentioned the extreme gun violence that has plagued our community and our youth. That's something that we're really big on here at the Therapy Fund Foundation. We do a lot of work to help end gun violence, to help with anger management, because I often wonder if individuals had the tools to better communicate, respond with emotional intelligence and strategically, not through the barrel of a gun, how many people would still be alive today, and how many people would not be incarcerated if we had those skills. So that's something that we do as well, Therapy Fund Foundation. Other resources, of course, Dr. Conrad's organization, Black Boy Heal, Beam. I love the work that Beam is doing. I mentioned the Nat Ministry earlier, and the work that they're doing just around getting people to take rest and breaks. Let's see what else. There's the Loveland Foundation, which supports Black women only with free therapy. There's the Boris L. Henson Foundation, which also provides free therapy to Black community members. There's so many different organizations. When we think locally, I love, the Tubman Center. I'm trying to think. I don't want my mind's drawing a blank. Let's see, there's so many different local organizations out there that are doing great work. Gathering Roots, I love the things that they're doing.
I ain't got that much as Ashley, but I was gonna say the Therapy Fund, but because we're a new organization out here, I'm not as versed in the state of Washington with the resources. But Therapy Fund, if you have an African American youth through the K through 12 school system that needs support, we provide that support. We have licensed therapists who can talk to your children. And we also have a journal for African-American youth who need to build up their mental health capacity and get throughout the day. So how does that look? So we have a journal for that. And we also have an app just in case they cannot meet with us face to face. They can get on the app and meet directly with a therapist. and also chat with their friends who are also part of the Black Boy Hill, you know, because maybe sometimes their peer is the best person that they can talk to at the moment, and they don't want to talk to a trusted adult.